Hi everyone, it's me back with another video, an actual follow-up video to a follow-up video regarding my condition. I had hyperaldosteronism a few years ago. I had a lot of questions in the comments regarding how am I doing since I was had surgery for a benign tumor on my right adrenal gland. That right adrenal gland was removed. I still have my left. It's been a couple of years later, almost 5 or 6 years later now. I'm completely fine. No problems whatsoever. Because they were able to go ahead and just remove my adrenal gland laparoscopically, I didn't have to have any long stay in the hospital. I didn't have a major cut. So I just pretty much was an outpatient, just in for that day and left with it. I think it was like a couple of hours, I believe it was. It's getting longer ago now. I can't really remember, but I do know I didn't stay past a day. So basically after that, everything resolved itself, meaning I didn't have any problems with my blood pressure anymore. And mind you, my blood pressure used to be like 200 over 100 and something, just because of that benign tumor that was sitting on my adrenal gland. It was like 3 millimeters, I believe it was. But it was enough to cause a major problem, to the point where my potassium was extremely low. Had to take pills, the whole 9 yards. So I suffered with that a couple of years, but you can see it in my old video. So basically everything is good. No problems whatsoever. At the time of my surgery and while I was having those problems, I was very overweight. So since then, I've lost weight on purpose, on my own, no help with any type of lap band or some fast or any other concoction. I just basically embraced the ketogenic diet, and so I've lost 152 pounds since, oh gosh, 2012, I believe it was. So I basically watch my carb intake. So, and it kind of differs from the Atkins. Atkins is more, you could just still, your carb counter. However, they can still do like the shakes and the bars and that sort of thing. But for me, I just would rather do just regular food, not a lot of processed stuff. So I really don't do anything in a box other than bacon. Anything processed in a box. Now, if you do that, more power to you. You're good. You know, it's just that this type of lifestyle, the ketogenic lifestyle, it just kind of really works for me. And I don't miss sugars. I don't miss breads. I don't miss anything like that. And of course, within the lifestyle, there are alternatives. So instead of regular pancakes, you could do almond flour or even cheesecake, or not cheesecake, cream cheese pancakes. So it's just kind of like up to you, and just research it for yourself. Never just take anybody's word for it. Just research it for yourself. Check with your doctor. See if it's actually a good diet for you, or whatever diet you choose to partake in that will help you live a better life. So yeah, as far as any problems after the surgery, nothing whatsoever. Everything was beforehand when I didn't know what was wrong with me, and was just going to the doctor, had faith in my doctor, and he was going as hard as he could. He didn't know the benign tumor wasn't, I guess, big enough to show up on a scan at the time. And so he was on all he could do. And I love him for that, because, you know, some people can write you off and say, well, just take these pills for the rest of your life. But he was determined to help me get better. But I just had a second mind come to me and say, well, maybe you need a second opinion. And so that's what I did. I went to a different doctor, and I can't say that, oh yeah, this doctor just found it. It could have been because it was a process, like a couple of weeks, even a month or two. So who knows? Maybe the tumor got larger to be seen on a scan by the time I got to the second doctor. But I went to the second doctor. She found the tumor. We removed it. I was out of the hospital in no time, back to my normal life. And I always say I did not understand how much of a fog I was in, a mental fog, until after my surgery. I gained so much mental clarity, as far as like my mind wasn't all over the place, wandering, always worrying. I don't know, when your body's out of sync, you have telltale signs. I mean, I guess it's up to you to be aware of them. And I don't know if it's just a situation where they're small and minute telltale signs, and as time goes by, they get worse, and you'll really tell that something's not quite right. But Yeah, that was definitely the case for me. But after surgery, everything turned out well. And pretty much that's it. Um, I'm just trying to think of some of the questions that I got, but they were mainly just kind of like, how are you doing now? And I'm doing well. Things are good. I just turned 40, so I don't have any problems whatsoever as far as like fertility, according to my doctor. If anything, when I lost the weight, he was saying, oh, now you're very fertile. So, I mean, that's the only thing regarding my health that has taken a change. But as far as me needing any type of, look at my little cat, any type of medication or anything like that after surgery, nothing. Now, if you do have to have both adrenal glands removed, you still live a normal life. You know, you would just, of course, have to take medicine to compensate what your adrenal glands would do for you on a daily basis. So that would be up to you to take your medication just like you would do anything else during your normal daily routine. So I hope this video helps. If you have any more questions, definitely feel free to give me a comment below, or do like you did before, send me an email, however works for you, and I'll try my best to respond as soon as possible, or even make another response video, especially if it's the same question being asked by several people. But definitely, thank you so much for following me. I know I'm not as active as I could be, but thank you for the follow, thank you for the questions, and thank you for the well wishes, and good luck to you on your journey.